Almost 5 million Canadians are caregivers, and they provide nearly 90% of the care needed by older adults living with long-term health problems. Unfortunately, this unpaid caregiving comes with a cost to their physical and mental health. In Ontario and Alberta, we're taking a close look at who these caregivers are, the roles they play, the burden they carry, and the support they need.
It's important to remember that every caregiver is unique, and this diversity must be recognized. For example, some also care for young children, others participate in paid employment, and those who are new Canadians often provide transnational caregiving to family at home. As a consequence of this diversity, caregivers have very different needs. Most caregivers struggle with the significant changes they experience and the multiple responsibilities that they hold.
Well, it's very good that Ontario is taking a patients first initiative, but there are some realities to consider as well. There are financial restraints that would impact upon how much the patient's input would actually generate reality for them. And in other instances, there would be issues between the patient and the family as to whether they'd be in a position to really advocate for themselves.
In our study, we found that caregivers' physical and mental health did decline. In particular, at the 6-month time period, we saw significant differences in their mental health. We also were able to compare, though, their physical and mental health scores with an average Canadian. And in doing that, we found that their scores were significantly lower than an average Canadian. And what that means is that we have a whole population now of caregivers who have poor physical and mental health who are now needing to access the healthcare system. This very significant finding has a way of moving us forward that we've not had before. We really should be building support programs, building resources to help caregivers have this confidence to deal with the difficult situations. Why this is so important to think about is that we haven't understood till now how many ongoing difficult situations they have all the time and how they're always problem solving, sometimes very instantaneously, in terms of what needs to be done. So what they need is a whole range of ideas about how to deal with difficult situations, and they also need to have the confidence that they have that ability to do it.
Sometimes specialists treat people and patients as they don't look at the whole person. For example, my family member who had a heart issue, once the heart issue had been looked after, the specialist said he could go home. And here he was, he couldn't get out of bed, couldn't move from his bed to his wheelchair without the help and support of at least 2 nurses. And suddenly she realized something, she began to listen to what I had felt that my family member needed.
We invite you to follow the progress of our research by viewing all the studies on our website.